Hello everybody. Today we'll speak about type 2 glass ionomer cement. It is presented as objective structured, which is required for practical examination. The ADA specification number of type 2 glass ionomer cement is 96. The main way of identifying the glass ionomer cement is again going through the package. Either it would be indicated as type 2 or sometimes it would be indicated as a posterior restorative cement. It is available as a powder and liquid and also pre-proportioned capsules. Glass ionomer cement is the generic name of a group of materials that use silicate glass powder and aqueous solution of polyacrylic acid. This is the definition given by Kenneth J. Anuservice. And according to J.W. McLean, glass ionomer cement is a basic glass and an acidic polymer which sets by an acid-base reaction in between these components. It is an acid-base reaction between acidic polyelectrolyte and basic glass powder. Decomposition of glass powder by acid resulting in the release of ions. In migration phase, the ions migrate into the aqueous medium. In gelation phase, caused by the multivalent aluminum and calcium ions displacing various spheres of hydration that interpose themselves between the cation-anion pairs. Post-setting hardening and slow maturation phase, where hardening and precipitation continue for about 24 hours, accompanied by slight expansion under conditions of high humidity and development of translucency. This would be the diagram that you can put on your paper in order to understand the setting reaction to your examiner. So here in this diagram, we have put the unreactive glass particles and the polyacrylic acid. And when the polyacrylic acid comes in contact with the glass particles, indicate the release of calcium ions, alumina phosphate and fluoride, and leading to a gel phase. And finally, the set glass ionomer cement, which is ionically cross-linked polysol cement matrix containing anions and cations. The working time and the setting time, it sets rapidly in mouth, that is within 3 to 5 minutes, and hardens to form a body having translucency and matches the enamel. The setting time of a type 1 glass ionomer cement is about 5 to 7 minutes, and setting time for type 2 glass ionomer cement is about 10 minutes. The factors affecting the rate of setting: the glass composition, higher alumina silica ratio, the faster the set and shorter the working time. Particle size, finer the powder, faster the set. Addition of tartaric acid sharpens set without shortening the working time. Relative proportions of constituents, greater the proportion of glass and lower the proportion of water and faster the set. Temperature, then the role of water, reaction medium into which the cement forming cations are leached and transported to react with polyacid to form a matrix. Hydrates, silicaceous hydrogel and metal polyacrylate salt formed. The water can be of two forms: loosely bound water, readily removed by desiccation, and tightly bound water cannot be removed and is associated with the hydration of shell of the cation. Polyacrylate bond, particularly that of aluminum and some silica gel water. With aging, tightly bound water increases, and increasing the strength, modulus of elasticity, and decreasing the plasticity. The cement is stable in an atmosphere of about 80% relative humidity. High humidity absorbs water, leading to hygroscopic expansion. Dry condition loses water, leading to shrinking and grazing. Loss of water also retards the cement formation. The uses: it is used for anterior and both posterior restorations. For an objective structured practical examination, we need to first identify the material, put the ADA specification number, the powder liquid ratio for the manipulation, the setting reaction. If you didn't have enough time to write the entire setting reaction, you can just draw the diagram as I have mentioned. The uses of type 2 glass ionomer cement, and name the spotter based on each classification. So we spoke about different classifications. under each, let's say this is a restorative cement, under each classification what this particular restorative materials falls under. Thank you.